Good evening. This is All India Radio Kohima. I'm Jonas Yantan with Evening News. The headlines. Advisor Moatoshi Longkumer expresses concern on accessibility and proliferation of drug use and abuse in the society. Prime Minister Narendra Modi says India to become developed country by 2047 with joint efforts of people. Union Health Ministry issues health advisory to states and union territories on evolving cases of diseases. And Cabinet approves 4% hike of Dearness Allowance to central government employees. Now the news in detail. Advisor for Excise, Labour, Employment and Skill Development, Moatoshi Longkumer, has expressed concern on the accessibility and proliferation of drug use and abuse in the society. The advisor was speaking at the introductory meeting of the Excise Department officials at a conference hall of the Commissioner of Excise today. He stressed that there will be a change in the system and work culture of the department that will promote and reward meritocracy. On the Nagaland Liquor Total Prohibition Act, he was of the view that if it stays, it will have to be enforced and encourage the personnel to prove their worth as the department is fully empowered under the Act. Commissioner and Secretary Excise Department Gevin Zehol congratulated Advisor Moatoshi Longkumer on his new tenure. He informed that the department has various ongoing proposals pertaining to infrastructural development, check gates, activation, and narcotics-related matters. Zehol expressed hope that under the able leadership of Moatoshi Longkumer, the various projects under the department will be realized. Prime Minister Narendra Modi has urged every Indian to contribute towards making India a developed country by 2047. He said that the doubt whether India can be a developed country in 25 years can be answered through Sankalp Se City and Sabka Prayas. The Prime Minister was speaking after inaugurating Sri Madhusudan Sai Institute of Medical Sciences and Research in Muttenahali in Chikkabalapur district of Karnataka. Established by Sri Satya Sai University for Human Excellence, the institute will provide free medical education and offer free medical treatment to the poor. Making it clear that vote-buying politics has never benefited the poor, the Prime Minister pointed out that the service deliveries and good governance model of the double-engine governments in the centre and the states. Modi added that medical infrastructure has developed, increased medical colleges from 380 to 650, and 40 among them are in the aspirational districts that are backward in various parameters. Union Health Ministry has asked states and union territories to keep a close watch on the evolving cases of diseases including COVID-19, influenza-like illness, and severe acute respiratory illness. In an advisory, the ministry said that COVID-19 and influenza share a number of similarities in terms of mode of transmission, high-risk population, clinical signs and symptoms. It said these diseases can be prevented by following simple public health measures, including avoiding overcrowded and poorly ventilated settings, using handkerchiefs or tissues while sneezing or coughing, wearing a mask in crowded and closed settings, maintaining hand hygiene, and avoiding spitting in public places. The ministry also stressed raising community awareness regarding adherence to respiratory and hand hygiene to limit the transmission of these diseases. Central government has increased the Dearness Allowance by 4%, taking the total to 42% of the basic pay for central government employees and pensioners. Briefing media in New Delhi yesterday, after the cabinet meeting, Information and Broadcasting Minister Anurag Singh Thakur said this will benefit over 47 lakh central government employees and more than 69 lakh pensioners. He said Union Cabinet has given its approval to release an additional installment of Dearness Allowance to central government employees and Dearness Relief to pensioners with effect from 1st January this year. Thakur said the combined impact on the exchequer on account of both Dearness Allowance and Dearness Relief will be over 12,815 crore rupees per annum. The Union Minister said this increase in the Dearness Allowance is in accordance with the accepted formulary, which is based on the recommendations of the 7th Central Pay Commission. This news comes to you from All India Radio, Kohima. You can also listen to this news bulletin on News on Air app and YouTube channel AIR News Kohima. In a special series, All India Radio brings you excerpts from the Prime Minister's Man Ki Baat.
People, voice and direct dialogue. That's your and our Man Ki Baat. Yes, this is how our Prime Minister connects with millions of countrymen. With the program Man Ki Baat, aired on the last Sunday of every month on All India Radio. This series, which started on October 3rd, 2014, will complete its 100th episode in April 2023. In this 20th episode, let's listen to those excerpts of Man Ki Baat through which the Prime Minister spoke about promoting cashless transactions. In his tenure, Prime Minister Modi has created many success stories, and one of them is our country's rapid strides towards a cashless society. We can see its effect all around today. Going by the statistics of the year 2021-22, the country saw more than 5,500 crore cashless transactions, which is 5.5 times more than what one saw in the year 2016-17. Prime Minister Modi, in the Man Ki Baat episode broadcast on 22nd May 2016, appealed to the people to go for cashless transactions in this way.
पूरी दुनिया कैशलेस सोसाइटी की तरफ आगे बढ़ रही है। इलेक्ट्रॉनिक टेक्नोलॉजिकल व्यवस्था के द्वारा हम रुपये पा भी सकते हैं, रुपये दे भी सकते हैं, चीज खरीद भी सकते हैं, बिल चुकता भी कर सकते हैं, और इससे जेब में से कभी बटुए की चोरी होने का तो सवाल ही नहीं उठेगा। हिसाब रखने की भी चिंता नहीं रहेगी, ऑटोमेटिक हिसाब रहेगा। शुरुआत थोड़ी कठिन लगेगी, लेकिन एक बार आदत लगेगी तो ये व्यवस्था सरल हो जाएगी।
The special Man Ki Baat series can be heard every day in the morning and evening bulletins. Union Health Minister Dr. Mansukh Mandaviya has said that India is ready to lead from the front and become the voice of the global south in the collaborative fight against tuberculosis. Dr. Mandaviya was addressing the 36th board meeting of the Stop TB Partnership in New Delhi today. He stated that India has identified 3 important health priorities under the G20 presidency, and all of these are focused on universal health coverage and relevant to our response for TB elimination. The Union Health Minister added that a lot of exceptional work is being done at the ground level through innovation in case finding, mathematical modeling, digital interventions and surveillance. Samagra Shiksha under Rashtriya Avishkar Abhiyan Nagaland organized a 2-day study tour for secondary school students with an aim to promote inquiry-based learning outside the classroom. A press release issued by Deputy Mission Director Samagra Shiksha stated that the team consisted of 33 secondary students and 11 teachers from across the state and 2 officials from the State Mission Office. During the visit to the Council of Scientific and Industrial Research Northeast Institute of Science and Technology, Jorhat, Director Dr. G. Nahari Sastry, along with his colleagues, had an interactive session with the students. The team also visited Majuli Island, which is the biggest river island in the world. Later, they visited the Science City and Planetarium, Jorhat, where the students got hands-on demonstrations on some concepts of science. Union Minister for Environment, Forest and Climate Change, Bhupendra Yadav, said that Project Cheetah is in line with Prime Minister Narendra Modi's commitment to environmental protection and wildlife conservation. He said this project will lead to enhanced livelihood opportunities for the local communities through eco-development and eco-tourism activities. Yadav said this while chairing a meeting of the Consultative Committee of Parliament on Project Cheetah in New Delhi. He expressed his gratitude for the steps taken by the central government for bringing the cheetah back to India and restoring its lost glory. The Union Minister stated that the government is determined to conserve and protect wildlife and the environment with the active participation of all stakeholders. Urban Primary Health Centre under the Chief Medical Officer, Walker, today organised a monthly outreach health camp at Springdale School, Walker. Students, parents, as well as a total of 183 patients took part in the camp. Services like doctor consultation, lab services, immunization, and free medicines were provided. The camp was organised in collaboration with the District AIDS Program Control Unit, Nagaland Users Network, and National Vector-Borne Disease Control Program. And now 20 News, here are main points again. Advisor Moatoshi Longkumer expresses concern on accessibility and proliferation of drug use and abuse in society. Prime Minister Narendra Modi says India to become developed country by 2047 with joint efforts of people. Union Health Ministry issues health advisory to states and union territories on evolving cases of diseases. And Cabinet approves 4% hike of Dearness Allowance to central government employees. That is all we have in this evening news bulletin.